Hey beautiful people, it's your girl Frankie here, and yes, I'm back with the pros and cons of operating room nurse. Now, I'm gonna start with the pros just because I feel like there's way more pros than cons, so I'm gonna try to keep it as organized as possible. I didn't make notes, so we're about to see how this goes. Pro number one that I will say is that you have one patient at one time. I absolutely love it because it's not just your patient, it's everybody's patient. Everybody's focused on this one patient that's getting surgery, right? So that's always just such a relief that you have so many people advocating for this one patient, and everybody is responsible for this one patient, right? So I know bedside nursing, you have your patients, but ultimately you are like the one that's actually physically there. But in the operating room, everybody is physically there. So the surgeon is there, the anesthesiologist is there, and then you're there, the scrub tech is there. Everybody is responsible for the patient's safety and advocating for the patient, making sure the patient stays out of harm's way. You know, because once the patient is asleep, they can't speak for themselves. So everybody is focused on the one patient. So I really like that. Pro number two is that you are not physically given any medications. You're not doing any baths. You're not doing any of that type of things. Like, you have a whole nother skill set for the operating room. So really all of that stuff is taken care of in pre-op of whatever they need. But anesthesiologist most likely gives all the medication, all the narcotics. The only thing we really pull is basic stuff like lidocaine, like numbing stuff. We may pour some saline to the sterile field. All this stuff is being poured onto the sterile field in like containers and stuff. So the surgeon actually is the one that uses the medication, that injects the patient or whatever medication is being used. He does that, and anything else, the anesthesiologist does it. Also for vital signs, the anesthesiologist monitor this patient like a hawk. The whole time during surgery, they are monitoring this patient, doing medications and also vital signs and all that stuff. So you're not responsible for documenting any of that stuff. That is what they do. So that takes like the workload down a little bit, in my opinion, which I really love. When you come from bedside, when you're doing basically everything, you're the phlebotomist, you're the CNA, you're everything, you know what I'm saying? So another pro that I will say that is super huge is that breaks and lunches, you get your breaks and lunches, and you can enjoy your breaks and lunches without no interruptions. When I say I'm not used to that, I'm not used to that. No interruptions, y'all. So somebody will come and relieve you that's just as qualified to watch that patient as you are. So another RN will come and relieve you for you to go take your break and your lunch. And you ain't gotta worry about nobody calling your phone. You ain't gotta worry about trying to hurry back, like none of that. You enjoy all your minutes to yourself. And yeah, another pro is giving report. You're not giving super long reports because one, there's not really too much of a report to give. When you are circulating the room and somebody comes in to relieve you for breaks and lunches, it's a simple report. You're telling them their name, if they have any allergies, what surgery is being done, if they should suspect or expect any specimens to come off the field, like if the doctor want to take tissue samples or whatever and send it down to pathology or whatever, like, you know, you just let them know, hey, they're probably gonna pull this and want this sent down to pathology. It's a very simple, quick report. So another pro that I will say is that shifts. When it comes to different shifts, like they have so many choices for shifts that when I got hired and it was like, what shift you want to work? What shift should I got? You know what I'm saying? Because in my mind, I'm used to 7A to 7P, 7P to 7A. That is like the basic nursing schedule. Like every nurse knows that. Operating room, they go by different rules. Like they have 8-hour shifts, 10-hour shifts, and 12-hour shifts. So it was like, what is this? What is this? You know what I'm saying? So when they show me all the list of times you can work, I'm just like, I need a moment to think about it, because I never had so many options for a shift in none of my nursing career. So the shifts they have, you could do 7 to 3, you could do 7 to 5, or you could do 7 to 7. You can come in at 9. You could do 9 to 5, 9 to 7, and 9 to 9. Or you can come in at 11 in the morning and do 11 to 7, 11 to 9, 11 to 11. You could do that. They do have night shifts. However, night shifts are a little bit, they don't have too much staff on there, and they pretty much have staff that's probably been there a while. So they kind of are covered on night shift, but they do have on-call sometimes. So we will get into that in a moment. But night shift is kind of one of those seniority type of things. And yeah, when I tried to do night shift, they didn't have it available. Yeah, so they didn't really have night shift available when I was going through the shifts. So anyways, long story short, I picked weekend option, which is an option where you get paid like so much more money, but you do every Friday, Saturday, Sunday from 7 A to 7 P, which I'm cool with that. I'm getting more used to day shift, but you know, I come from night shift. I ride for my night shift nurses all day, every day. Not gonna change. But yeah, so once I get out of training, I will be doing the weekend option, you know, as I stated in the previous video anyways. So I will say that is a pro, that there are different schedulings that you can do. So if you got kids or you got stuff to do, you can kind of pick a shift that works for you in your household, right? So let's go ahead and get into the cons, because I don't want to make this video too long. I'm already at so I don't want to make the video too long. But for the cons, one con I will say is that you do have to do on-call. So I've never been in a job where you have to sign up for on-call hours. Like if I'm off, I'm off. But on-call, like if they need you and you signed, like you have to come back. Or you coming in on an off day, or whatever days you sign up, or whatever the requirements are for the on-call for your department. Yeah, like no. I was like, that ain't for me. However, that is a con, because a lot of people don't know about that. I didn't know about that until I got hired, and then they were like telling me about on-call, and I was like, what is that? But I do weekend options, so I don't have to do on-call. But for any of the other shifts that's there during the week, they have to pick up on-call hours, and you sign up for hours. Just kind of like, you know, so if they have 40 hours of on-call you have to do that on top of your 40 hours within a 6-week period of completing those 40 hours of on-call. But it's complicated. I don't want to scare you guys off, because it's probably not as complicated, but me not knowing what the on-call is, it sounded like a lot. Okay, it just sounded like a lot. So don't be shocked when they be like, oh, you have to do on call or whatever. Like this, I can't really make it no simple right now, because I don't quite understand it. But yeah, I'm glad I don't have to do it. So I think that's the bottom line what I'm trying to tell y'all. I don't have to do on call, so I'm happy. So it's a pro for me that I don't have to do it. But however, just so you guys know, that is a con. Another con is surgeons. I'm sure you will hear this if you watch other operating room nurse pros and cons videos. But surgeons, some of them can be rude. A lot of them are really nice though. So don't let that scare you. Some of them can be rude. However, you have to just stand your ground, if that makes sense. Like if you feel like something was rude and not appropriate, unprofessional, you can say that. You can stand up for yourself. But of course, pick the right time and right place. Don't do it in the middle of surgery. But you definitely let them know, you know, if you need my help or whatever, you know, I don't mind helping you, but you know, talk to me with some respect. Put some respect on my name. Or you can wait till after the procedure and surgery and let them know afterwards, or you can let management know, or you can fill out a form. I mean, yeah, but don't just let people walk all over you. Say it in a professional way, but just let them know, you know, it's not going to be tolerated, period. Okay. But another con that I will say is that you don't really get that You will lose a little skill set, and you will not get all that time with like patient care, if that makes sense. Hopefully it makes sense to y'all. But because you spend a short amount of time with your patients before they are asleep, even though you're still doing patient care and watching your patient, but as far as that talking and building that trust, you only have a small window to do that. So when you go to check in your patient, basically you're going in there and you're going to ask them, you're going to look at their bracelet, ask name, date of birth, and you're just basically asking some simple questions, but you have to build their report. So you're asking about allergies, if they have any allergies that we should know about. Also, you're asking about like any metal in their body, things like that from previous surgeries. Last time they had anything to eat or drink, and anything removable like jewelry, contact lenses, hearing aids, glasses, anything that they need to like not take with them to the operating room. A lot of times they have families, so it is nice to greet the families and kind of talk a little bit with the families as well. And, because if they do have anything, the family is going to take it, but it's just good to know who was with them. Because sometimes the surgeon may ask you, did they have family with them or who did they have with them? Because sometimes after the surgery, they want to talk to the family. So it's pretty good to know, even though the surgeons do see that, but sometimes the family members don't be in the room. They may go to the bathroom, they may go grab something to eat. You just never know. So it's just good to know who was in the room with them. And also for your notations, like when you're noting and documenting everything, like if they did have glasses on, you want to document that, hey, they left their glasses with their husband or whatever. You know what I'm saying? So it's just good to know and to build their report in such a short amount of time, because really you're the one that's advocating for them. So when they come back in that operating room, they're scared, and you definitely want to make them at ease. So that would be a con to me, just because it's such a short amount of time to like get to really talk to your patient. Because usually by the time they get back to the room, we are moving them over and anesthesiologists are doing their thing and we're doing our thing and the patient is out. So it goes pretty quickly for them to actually go to sleep. So I would say that's a con, but that's pretty much all the cons that I have for the operating room, which are not super big, but that's why I'm like in the operating room, because the cons are definitely not major cons in my opinion. So yeah, so that's pretty much it. Hopefully you guys learned a little bit more about the operating room, and maybe you should give the operating room a try. I will say starting off is very difficult because it is a different skill set than on the floor. So on the floor, you probably good at blood draw. You probably real good. You know what I'm saying? But then in the operating room, it's more of like task oriented. So you're just making sure the room is set up appropriately, make sure the bed is set up appropriately, making sure that equipment is working right, making sure everything is in the room that you need. You are responsible for documenting, like positioning. You're doing the skin prep on the patients, putting in Foleys if they need a Foley. You are also noting everybody that's in the room. You got to put that on their chart as well. Like when you're documenting and clicking all these boxes. So you're kind of responsible for documentation in the room and just making sure the patient is safe, making sure nobody breaks sterile field, and positioning and stuff like that. So it's a pretty, once you get the hang of it, it's actually a really like simple job. Once you get the hang of it, just like any other job that you master and you've been there for a while, then you know what to do. It's like auto. But being someone that never worked in the operating room, it's like, okay, wait, this is like information overload. And me doing weekend option, I go to all the specialties, neuro, ortho. Everybody has different things that they do in those specialties. So one specialty is definitely not like another specialty. So neuro is completely different from ortho. You know what I'm saying? So yeah, it's different, like tools and instruments and stuff. It's just a lot, okay? And if they need something that they don't have on the sterile field, they're gonna say what they need. And you as the circulating nurse have to go and find this item. Just imagine not knowing what that item is. Baby, I'll be like, you need what? Okay, I repeat it back, and then I go in the hallway and I find somebody and I say, hey, do you know where this is? Like, and then I go get it, because a lot of people are pretty nice and they will show you where it's at or tell you exactly where it's at. So I really like that. But yeah, that's it. So that's all I got for you guys today. I hope you enjoyed it. If you have any questions, definitely comment them down below. And y'all already know, like always, I'll see you guys in the next video. Peace.